Welcome to the Empowerment Show with Melissa Heisler. Every week, discover new personal choices with practical, inspiring guides. And now, here's Melissa.
So happy Tuesday, all, and welcome to the Empowerment Show. I'm Melissa Heisler, Empowerment Coach at It's My Life, and it is your life. Live it. Today, I am joined by Anatoliy Pak, who has some interesting views on how the current health system encourages disease instead of wellness. To join our conversation, post your questions at facebook.com/The Empowerment Show or twitter.com/Empowerment Show. My guest is Anatoliy Pak, who has dedicated much of his life to cultivating an intuitive ability to help discover what people need to find their individual harmony and balance. Anatoliy has a Master's of Science degree in Traditional Oriental Medicine from Pacific College of Oriental Medicine and certification from the National Certification Commission of Acupuncture and Oriental Medicine. Welcome to the show, Anatoliy.
Thank you so much for having me.
We're very excited to have you here. We met about a year ago. I heard you speak to a group of healers and different people in the healing profession. And there were two figures that you brought up in your talk about the United States healthcare system that really surprised me. And that first number was that 17% of the United States gross domestic product, which was $2.4 trillion in 2008 and growing ever since, goes to healthcare. And the second figure that you brought up was that the third leading cause of death in America is iatrogenic deaths, or deaths that are related to medical treatments, with more than half of these deaths being caused by the negative effects of properly prescribed drugs. Can you talk more about these figures and how you think they relate to the American healthcare?
Yes, definitely. The number, as you said, is growing. I mean, the amount of money that we are going to spend for the healthcare purposes is going to be 4.3 trillion by 2017, which is 4.3 times more of money that we spend on national defense. So it's quite stunning to see how much money we spend if we compare all that space technology and all those fancy weapons and the whole army budget, and it's 4.3 times more than that. No matter how much we spend, I think it's important to understand whether we spend that money right, whether it helps healthcare purpose, which is to make people to be sick less or rather to be healthier. And unfortunately, the healthier part isn't happening now. And I think that the nature, the concept that we have in the modern healthcare system isn't working in a way to improve and restore the health of Americans. Rather, it deals with the diseases that should be fixed. So I think this is the main spot that should be resolved in order to get out of this crisis that we have now.
And I do want to get into how the current healthcare system looks, because you have a very interesting take on that. But I was wondering if you can explain a little bit more. You said a great phrase that was making people sick less versus making them healthier. Can you explain the difference between the two?
Yes, definitely. With the sickness, if we look at the sickness from the Western medicine point of view, it must be supported with the data, meaning that it should be diagnosed through certain technology. It should be framed into certain numbers, in the form of numbers. That's why they do those tests, and that's why they need images like X-rays and MRIs and so on and so forth. And as long as Western medicine, or rather Western medicine practitioner or doctor, medical doctor, has the tangible evidence of the disease, either through the tests or through the imaging technology or any other technology that would give tangible numbers, the person could be diagnosed with certain disease. And when there is diagnosis, that disease could be treated. And mostly, in most of the cases, it's usually treated by means of pharmacological drug therapy. So, versus to this concept, the absence of the health cannot be considered just by presence of the disease. Health is a way wider phenomenon. It's not just absence of those numbers, of bad numbers coming through the test or through the imaging technology. The health is overall well-being and happiness of the person. So this is the major difference between restoring the health, meaning fixing all the factors, the disease factors that are impairing the person's ability to be happy, including both physical symptoms or tangible data like abnormal blood cell counts or like blood pressure or whatever else that we can hear from a Western medicine point of view. But besides that, we should pay attention to the level of, let's say, psycho-emotional well-being, relations, the person's ability to, let's say, handle the stress, all those factors that is very hard to measure, but they are still very much present in anybody's life, and they are very natural part of the health of a particular individual. So when we say that fixing the disease, we are talking about the numbers. And if there is no numbers, there is no disease, there is no fix in Western medicine, but person can still be very sick, even though there is no diagnosis. Versus restoring the health, making sure that everything in the body works from physiological and anatomical point of view, but besides that, the person is happy with whatever he or she has in the present life.
I think that's a really good point, Anatoly. This is actually something that I had unfortunately experienced myself. I was going through a health crisis many years ago, and I went to a stream of different Western medicine doctors. And through their diagnostic systems, they weren't able to find anything wrong. They weren't able to find the numbers that were wrong. And so there was very little that they could do for me. Actually, there was nothing they could do for me. They kept saying, well, maybe we'll take out organs or we'll try you on this medication. But without that number, they couldn't see what was wrong with me, what was causing my dis-ease. They were saying, you're perfectly healthy, your numbers are fine. And yet I was in a lot of pain and a lot of discomfort. And so I really like your thought process of it's not about the numbers, it's not about the tests. There are phenomenal tests out there that can help a lot of people, but it should be a tool versus the primary mode of handling somebody's health. At least that's what I'm hearing from you.
Yes, absolutely. And this part is missing at the moment in our medically based healthcare system. It doesn't mean that other medical or other healing modalities are kind of not medical. Actually, everything is medical. It's just silly language limitations that we have nowadays, that we cannot name other practitioners as the doctors just because it's kind of a legal definition. The doctors are practitioners who are doing certain kind of medicine. But besides this point, what we lack in modern healthcare system is the broader view of human health. And if we allow people to access different kinds of medical concepts, different kinds of medical approaches to improve someone's health, then we really can be on our way to resolve the modern healthcare crisis. So it's about variety of approaches versus investing the money into the very narrow corridor of the modalities or medical approaches.
And I want to get into that, the look of the broader view of human health and what those variety of approaches, how they can benefit individuals. But I'd first like you to take us through what you lovingly call the healthcare system loop of self-destruction, so we can understand where you're coming from and how you view the the Western medical system here and what's happening to individuals' health because of it. And then I'd like we'll afterwards talk about other options that people have besides being in the current healthcare system that we have.
Let's start with the understanding of weakness of Western medicine. Western medicine is a great modality. It's great because it can save lives. And actually, originally, it was kind of the origin of the modern Western medicine. I'm not talking about like back to the Greece, like ancient Greece times, the Hippocrates and all those geniuses who were at the beginning of Western medicine. I'm talking about the kind of practicality of Western medicine that came up mostly in the end of 19th century, and it was developed a lot during the 20th century. So what I'm talking about is the critical care, meaning that we have a great medical technology to support human's life in terms of vitals. Vitals are like that the heart is working properly, that the lungs are breathing, that the brain is functioning, and so on and so forth. Meaning that without those functions, the body is just dead, physically dead. And this is what is the major focus of modern medicine. So it's critical care focused medicine, which is great. However, as I mentioned before, the human life is not just vitals. The human life way beyond those important things. It's also well-being. It's also being happy. It's also being functional, being able to sleep normally, being able to eat normally, being able to move normally. And with all those modern diseases that we have now, like autoimmune disorders and like arthritis and other kind of diseases of idiopathic nature. Idiopathic means that modern science and medicine doesn't know what causes those diseases and how it should be treated. With all those diseases, people are very sick. And quite often, again, there is not enough numbers, bad numbers yet, but people are already sick enough in order to be quite dysfunctional. So second point is that modern medicine, the economical model of modern medicine is based on the volume, meaning that the doctors and the industry is paid by the volume. The more services they produce, the more money they earn. The more drugs they sell, of course, the more revenue they have. So it led to the fact that we have overprescribed, we have too many procedures or drugs that are prescribed unnecessarily. There is no real reason for those procedures or drugs to be prescribed. And it leads to the increase of the level of the number of sick people, because all those drugs, they do have side effects just by default. There is no safe drug. No matter for what the drug is used, no matter who produced the drug. As long as it's produced in a human lab, in a chemical lab, it must have the side effects, because this is the way how it works. So it makes the official medicine, it makes Western medicine quite inefficient in making people like disease-free, because when they treat one disease, the treatment method often causes several other diseases. In other words, we fix one thing and we damage 10 others. This is the way how Western medicine works. So people are becoming sicker, not healthier. They might feel better with certain signs and symptoms that they have come to the doctor, but at the same time, let's say somebody came for the pain in the knee, and the patient was prescribed a lot of anti-inflammatories and then painkillers, and then it was cortisone shots, and then it was like probably surgical procedures, and the knee or shoulder got better finally. But at what expense? All those detoxifying organs like liver and kidney and digestive system quite often are just ruined by the side effects of all the drug therapy. So people are becoming sicker, and after they fix one thing, after they feel better with one thing, they have to see many other doctors who would address like digestive system, who would address the renal system, who would address cardiovascular system, and so on and so forth. So this kind of medicine leads to use of even more medicine, because when 10 other things are damaged, of course, people will seek the help from other medical professionals. So more medicine is used, and it means that the more money is spent for the medicine. And since modern medicine, medical system, or rather healthcare system, is based on the insurance financial model, so insurance has to pay more money for the medical services, and insurance cannot do it forever without increasing the income part of their business. Insurance company is out there to make profit, to make money. So they collect the premiums from the clients, and then they spend part of that money that they are getting from the premiums on the medical services. But they cannot spend all the money from the premiums. They have to have some profit. But when more and more medicine is used, the insurance company has to pay more and more. And how they handle this kind of disbalance? They, of course, increase the premiums, and you and I know this very well, and I'm sure that everybody who is listening now has been experiencing this, like getting notice every year from the medical insurance companies that your premium is increased due to increasing cost of medical services and so on and so forth. So the premiums are going up. On the other hand, the payments to the doctors are they are trying to reduce the payments to the doctors via creating more complicated billing system. So it's a kind of a very tricky game of making it more difficult for the medical professionals to bill insurance and increasing the premiums to the policy holders, and it leads to the situation when people cannot afford as much medical care as they could before. Why is it happening? Because if doctors are not getting as much money from the insurance company, they again have to get money from somewhere, and of course it's roll over to the patients. On the other hand, when the insurance trying to save money on the clients, they increase the premiums and they decrease the coverage. So less and less coverage is available to the people.
So when they have less coverage, then they're going to wait until things are more critical again before they come in. What I'm hearing you saying is that almost this whole issue that's going on in America with the healthcare system is the focus on critical care, whether it's because that's why, how Western medicine is built, and or that it's also that what's happening with the insurance companies, it's almost forcing people to wait until something's critical before they go to get help. And so it's really pushing them into, I think you call it structural disease, into that critical care disease, versus what I think that yourself and other alternative practitioners work in is something called functional. Is it functional disease or just functional health? And can you talk to us about, because this is all about empowerment, how can we empower our listeners to take back their health and to be able to get out of this healthcare system loop of self-destruction and have healthier lives, not just be sick less?
First of all, we have to stop to rely on the numbers, meaning that if we have pain, if we have dysfunction, and we went to the doctor, and the doctor said that you are a healthy person because all the tests came back negative, there is nothing wrong on MRI image or X-ray image, and so on and so forth, we cannot think that, well, then everything is normal, because the body still hurts, and pain and aches are there just to let us know that something is not right. It's like every modern car has the alarm system, those like red lights on the dashboard that let the driver know that you have to check the brakes or you have to change the oil or something is wrong with the electrical system, right? And as soon as we see those red lights, we don't want to drive the car. We want to bring the car to the auto shop. With the human body, with ourselves, it's quite opposite. We don't like to do anything about our body until something is really broken down. So we have tendency to wait till there is a bad number, and then we start doing something. And unfortunately, that care is starting from the most toxic way of fixing it, drug therapy, pharmaceutical drug therapy. So the first step toward improving our health is stop thinking that if there is bad number, I have a disease. If there is no bad number, I'm healthy. No, if it hurts, if you have dysfunction, body tries to let you know that something is not right. And it means that you have to do something. You have to take care about yourself. But if you can see that medical, modern Western medicine cannot help you, you have to be curious enough, you have to be open-minded enough to seek help somewhere else. And with the great help of internet, with the great help of all those mass medias that are providing both good and not good information, you can find the right practitioner for yourself. You can find the right medicine for yourself, whether it's naturopathic medicine or it's a homeopathy or it's chiropractic care or it's oriental medicine, whatever it is, whatever works. But you should be kind of thinking out of box. There is no only one medicine nowadays that can help you. From my point of view, the Western medicine doesn't have to be the first choice of fixing the problem. Actually, since the Western medicine is a critical care, this is really the situation when something is really broken. Then you can go to the medical doctor and then try to fix the structural damage. However, when there is functional damage, meaning that the numbers are okay, but you're still feeling not right, you need to go to the practitioner who is handling well the functional, dysfunction, problem with the functionality of the body.
And I think, to go back to your analogy about the car, right now we're all sitting around and waiting for that red light to go on in our body. That thing to say that, oh my gosh, now you have a tumor, you have high blood pressure, you have X, that, you've reached that critical stage. But what it really is just like you need to maintain your car. You need to go in every 3,000 miles and get your oil changed. You need to make sure that there's air in the tires. And you can notice before the light comes on that your car is running sluggish and maybe you need to change the oil versus waiting until there's major engine damage because the oil is completely out.
Actually, we can wait a little bit longer. The red light is there for a reason to let us know that this is the time to change the oil. The sign or symptom, the discomfort, is there to let us know that we have to take care about whatever problem we have started to develop, whether it's digestion or it's about blood circulation or it's like nervous system. But we don't want to wait till the numbers are bad. And the numbers are bad, it's like the car's engine is broken down because we haven't changed the oil for like 20,000 miles or whatever miles it gets. So it's okay to get to the point of red light. It's okay to get the sign or symptom like headache or insomnia or whatever else, but it's not okay to still not addressing it when it happens for, let's say, for a week. It's not going away after, let's say, 1 or 2 times of like Advil or Tylenol. It means that something should be addressed in a more serious way. And more serious way doesn't mean stronger drug or different drug. The stronger way means that we have to talk to somebody who knows how to handle and improve the functional problem.
Exactly. And I think that's some great parting words for our listeners is really to take back responsibility, to be aware of what your body is doing and how it is feeling, and to not rely on jumping, to stronger and stronger medications, but to try to be more aware of what's actually going on and finding those functional care providers who can help you before it becomes a larger problem.
Absolutely.
Well, thank you so much for being on the show, Anatoly. You certainly have some incredible information, and I know you take very good care of those people who come and see you at DeerfieldCommunityAcupuncture.com. You can find Anatoly and more about him in Deerfield, Illinois. And again, thank you so much for being on the show, Anatoly.
Oh, thank you so much for having me, and I hope this broadcast will cause some vibration, some movement in the universe, and people will start thinking differently.
I have that same wish, Anatoly. Thank you so much.
Join Melissa Heisler next week right here at The Empowerment Show. Join the conversation at facebook.com/The Empowerment Show or twitter.com/Empowerment Show.